Hello. Today we have The Importance of Cultural Awareness in Pharmacy, brought to you by Carly Greenhoe and Heather Rodriguez. According to the U.S. Census Bureau, in the year 2000, roughly 30% of the U.S. population was made up of minority groups, and that percentage is expected to continue rising. This figure is an indication of the ongoing changes our population is experiencing. With this increase in minorities, the diversity of communities is also increasing. This change can present a serious dilemma to the healthcare field in regards to providing the appropriate and necessary care for each patient, while also taking into consideration the differences that may need to be accommodated based on the person's culture. Communication, cultural competency, and lessening the gaps leading to health disparities are all areas of interest that can be developed and enhanced to enable delivery of the best care possible to each patient regardless of their background. As pharmacists, communication is one of the first and most important aspects in building and forming a relationship with one's patient. The goal is to create a trusting alliance with patients so that both the patient and healthcare provider can gain a mutual understanding of the issue being addressed. This communication should establish a relationship with the patient by providing an outlet for the exchange of information, utilizing listening skills, and removing barriers, thus improving the patient's perception of the overall experience. When communication is not clearly established between a patient and a healthcare provider, problems can arise. As quoted here, patients frequently complain that the doctor did not introduce themselves, that they were not sure who they were seeing, or what their role was within the team. This lack of communication can have a negative impact on patient safety. However, in an effort to prevent this from occurring, introduction systems such as AIDIT can be used to open up communication at the commencement of a patient encounter. AIDIT is one of the introductory tools that can be implemented to help improve communication between the patient and the provider. AIDIT stands for Acknowledge, Introduction, Duration, Explanation, and Thank You. The individual sections of AIDIT cumulatively work together as a way to ensure consistent communication. There are many beneficial outcomes that may come about when utilizing AIDIT, including decreased patient anxiety, increased patient compliance, improved clinical outcomes, and increased patient satisfaction. An important conflict that arises and should be noted is that while AIDIT may be an extremely useful tool, it is virtually useless in cases where the patient speaks a foreign language and thus can't understand what you're saying. When this type of language barrier is encountered, it can present a challenging feat one must overcome as a healthcare provider. This might cause the patient to be even more anxious and unsettled, which would ultimately lead to a decreased patient compliance. The above graph depicts the idea of poor communication between patient and provider due to cultural barriers. As displayed, racial and ethnic minorities are more likely than non-Hispanic whites to report experiencing poor quality of patient-provider interactions. As a result of this poor provider-patient communication, it has been linked to a decline of adherence of instructions and patient satisfaction and health outcomes. This demonstrated decline in communication between minorities only exemplifies and further stresses the importance of cultural awareness in the healthcare system. One of the tools that can be utilized by pharmacists to help them become more aware and culturally sensitive is the RESPECT model. This model is an action-oriented set of communication and relational behaviors designed to build trust across differences of race, class, ethnicity, culture, and power. Each letter in the RESPECT acronym stands for a particular idea, all with some sort of focus of how best to communicate with the patient. So the first letters are for rapport, connect on a social level, seek the patient's point of view, put off judgment, recognize and avoid making assumptions. The E stands for empathy, seek to understand patient's rationale of certain behaviors or illness, and verbally acknowledges and validates the patient's feelings. S for support states to ask about and try to understand barriers to care and compliance, help patient overcome barriers, involve family members, and reassure the patient. P for partnership says be flexible with regard to issues of control, negotiate roles when necessary, and stress that you will be working together to address medical problems. E for explanation states check frequently for understanding and verbally clarify. C, cultural competence, respect the patient's culture and beliefs. Patients' views of you may be stereotypical or biased. Be aware of your own bias, know your limits, your style may not work for every patient. Trust, self-disclosure may be an issue for some patients who are not accustomed to Western medical approaches, so take the necessary time and consciously work to establish trust. While this model is an excellent tool for clinicians to use in detecting disparities present in provider-patient relationships, it can also be used as a good learning tool for students in the medical field. By implementing this as a part of the school curriculum, it allows for the simulation of real-life situations, providing students with the opportunity to gain an understanding of how to handle a variety of patient encounter scenarios. Another tool that can be used to assist in cultural competency depicted above is the Purnell model. The framework of this model has many segments. The outer four rims are considered the macro aspects of this model and correspond from the outermost ring inward as follows: global, society, community, and person. From there lie the interior portions of the wheel, the micro aspects. The interior is then divided into 12 domains, including factors such as heritage, communication, family roles and organization, workforce issues, highest behaviors, and so on. The dark center circle is there to represent the unknown, and along the bottom is the sawtooth line representing concept of cultural consciousness. An increasing level of understanding of competence is represented in the model while it views the provider progressing through 4 levels of cultural consciousness. The first being a stage of unconscious incompetence, followed by conscious incompetence, then conscious competence, and finally unconscious competence. The ultimate use of this model is for providers to utilize it as a guide in the development of assessment tools, planning strategies, and individualized interventions. Once the concept of healthcare and culture are fully understood, tools such as the Respect or Purnell model can be incredibly effective resources to implement in the workplace as a guide to help ensure each individual patient is receiving the best, most appropriate care possible for them. The presence of cultural dilemma is an issue that continues to contaminate the healthcare system in less than beneficial ways for both the provider and the patient. It has also been clearly demonstrated that due to these barriers between minorities and healthcare professionals, disparities continue to be an unfortunate reality that they must face. A large part of the situation can be attributed to a lack of cultural competency in the healthcare system. The incapacity to communicate and eliminate bias towards patients of unfamiliar backgrounds are two of the main areas that, with improvement, will significantly help improve these cultural gaps, leading to disparities, resulting in a better outcome for both the patient and the provider.